Hello and good afternoon and welcome to the first live program of Lib Street, Radio Chinwag's new liberal studies live interactive phone-in shows for secondary school students in Hong Kong. Today our guests are Mr. Andrew Chidgey, who is the Chief Executive of AIDS Concern in Hong Kong. Good afternoon.
Good afternoon, Lee. Great to be here.
Thank you for coming. And also Grace Ong, the Communications Officer from AIDS Concern as well. Hello.
So hello, I'm Grace.
Hello.
Great to be here.
Thank you for coming, Grace. It's very nice of you to be here. I'd like to start by asking you a little bit about the history and background of AIDS Concern with a specific focus on Hong Kong.
Sure. So AIDS Concern was set up in 1990, so we've been around for nearly 25 years. Back in the late 1980s, early 1990s, there was a panic spreading worldwide, particularly among major cities and nations, because HIV was starting to infect lots of people and many people were dying, so that's why we got set up. We started as a group of small volunteers, a small group of volunteers who were wanting to do something to make life better for people. So we visited people who were sick, we looked to support their families, and really it's developed from there.
Okay, and how many people volunteer or work on a full-time or part-time basis for AIDS Concern now?
We've got about 50 people working full-time and some more working part-time for us, but we also have a lot of volunteers working for us on and off. Some regular volunteers, about 20 of those, but also a lot of people who will do some of the day-to-day things that we can't do because of our limited resources, like helping us with events or getting all of our materials ready to go out and talk to people. So yeah, it's I'd call it a small to medium-sized NGO in Hong Kong terms.
Okay, I've been to your office in Chai Wan. There seem to be quite a lot of people in there. It's a fairly small office, but then everything is quite small in Hong Kong. It was very interesting to see it. Could you tell me a little bit about how everything is paid for? Do you rely on subscriptions and donations from the public, or do you have any public funding?
It's a mixture, actually. So about 2/3 of our income comes from members of the public who will give us either a monthly donation or they might give us a one-off donation from time to time. So that's where we get the majority of our money. We get a little bit of money from other supporters and events. We get some money from corporate donations. So a company like the Mac Cosmetics or Standard Chartered will be funding some of our work. And then about 1/3 of our money comes from a government body called the AIDS Trust Fund. So that's where our money comes from.
Okay, thank you. About the services that you provide, I know that you provide some HIV testing services and also HIV emotional support services. Could you explain those in some more detail for us?
Of course, yeah. So there are probably four main things we do. The first thing is about prevention, which is our key priority. So we've got to stop more people being infected with HIV. And we do this by getting out and educating people about what HIV is, the risks, and how you can protect yourself. So we have a lot of that work going on day to day. We work with bars and clubs, we work with schools and social workers, and talk through the public media as well. So that's a really big part. We'll then also have our testing service. We've got a site in Yau Ma Tei where people can come and be tested, but also we do testing all over Hong Kong in different locations. But then also the third thing is we help other organisations to make sure they understand HIV and get that into their core curriculum or service. And then also we do public advocacy work to talk about what needs to change to help people living with HIV as well.
Okay. The Yau Ma Tei Testing Centre, is that available to everybody of any age?
Well, we tend to... anybody can contact us to ask us about HIV testing, but we tend to target particular groups of people who we know very well. So we talk to young people who are a key target audience for us, and we will provide testing for anyone between 12 and 25 years old. But then also we do particularly target men who have different sexual partners, and then we also do target men, what we call men who have sex with men. This is gay and bisexual men, because these are the groups who we think are most at risk. So other people who talk to us, we will tend to suggest maybe they might want to go and get tested with particular organisations who are more geared up for them. But we won't turn anyone away if anyone really wants to come and get tested at AIDS Concern.
Okay, I was thinking that if a 12-year-old thought they were at risk, they were going to a testing centre which was predominantly filled with adults, they would be very intimidated by the experience.
Yes, I mean, what we tend to do is we've got a youth team of fairly young people who will take referrals if a young person calls, and we will look to make sure that perhaps they accompany somebody. So someone might call us and say, oh, look, I'm in a relationship, I'm worried that I might have been infected, or maybe they say, I think I've had unsafe sex and I'm a bit concerned about it. So we'll suggest that maybe we can help them get tested, or we might suggest to them that we could accompany them along to visit their doctor if they'd like that as well. Because you're right, not everybody will feel comfortable going along to a testing centre. I know plenty of adults who don't feel comfortable about doing that. So, okay, listeners, if you want to call and ask Andrew a question, please call us on 8120-4479. That's 8120-4479. Or you can contact us on Skype. Just type in Radio Chinwag, ask to be a friend of us, and then we will take your call. Okay, I was reading your latest newsletter today, the June newsletter, and that said that in the first quarter of 2014, that's between January and March of this year, there were 154 new infections, and that is the highest number of infections since 1984. And 1984 was I think the first year that HIV statistics started to be compiled. So that's actually a very worrying increase. Do you know particularly why that has increased and why it is increasing in Hong Kong specifically? There are a range of reasons for this, I think. I think the first thing to say is I don't think our reaction should be one of panic, because, yes, it's a rising number and it's very concerning. But really, there are a lot of things that we can do to prevent more infections and to make sure people understand how to protect themselves. So in terms of the reasons, I think the biggest reason is that not enough people are protecting themselves when it comes to having sex. So in different countries, there are different reasons for the epidemic. In some countries, the HIV epidemic is more because of injection drug use, or it can be because of sex workers where they're HIV positive, infecting others. But in Hong Kong, it really is about people having unsafe sex and unknowingly passing on HIV. And so for us in Hong Kong, the target needs to be helping people to understand that this is a risk and that they need to protect themselves and others. I think if you look at in more detail at the most recent infection numbers, what we can see is a rising infection among gay and bisexual men in particular. And I think there are a number of reasons for this. Partly it's biological, in that that gay and bisexual men, if they're having unsafe sex and having anal sex, then actually this does put them at high risk of developing HIV. We think probably 4% of gay and bisexual men in Hong Kong are HIV positive. So if people have unsafe sex with somebody, then they are putting themselves at risk. And I think, in the 1990s, a lot of people were very, very aware of HIV, and people were dying, people were very, very sick. It was a horrible time on HIV. And so I think that generation sort of understands it. But I think young guys growing up now, perhaps people in their 20s and some into their 30s, haven't come into as much contact as other people, and therefore perhaps they don't appreciate the risk as much. So maybe they haven't seen the pain that people go through, those who are infected, or maybe those who have died, or maybe those who have known people who have died? I think it's partly that, and I think in some ways HIV has become a much quieter issue because firstly it's now possible to get medication. So yes, it's still not good to get HIV because your health will be put at real risk, but you can get medication, and that means that that people are managing this on their own very often, or quietly with their families, and very often people just don't know that they've got HIV. And on the one hand, that's really good because it means that, you know, your medical condition doesn't need to be part of a public discussion if you don't want it to be. But on the other hand, it does mean that it's become, in many cases, much more private and much more hidden as well.
Okay. You talked about medication. I think I think it's important to stress that this medication is not a cure. There is no cure for HIV. It's a containment.
That's right.
It's a containment strategy. Is that right? What does the medication actually do?
Well, I think probably it's helpful if I explain a little bit about what HIV is and what AIDS is.
Yes, please. Yes.
So we all have an immune system. This is our body. All of our bodies are being attacked every day by millions of bacteria, toxins, and all sorts of viruses. And our body has what we call the immune system. So this is all sorts of organs that protect us. And some of them are very obvious things, like our skin prevents lots of infections coming into our bodies. But also within our blood, we all have white blood cells. And these are really important for fighting off infection. Someone with HIV has a virus in their body which is attacking white cells. I won't go into the complex detail, but it's white T cells, they're called. And when these are damaged, it becomes very difficult for the body to fight off infections. So HIV damages the white blood cells. And what it means is that someone with HIV can pick up all sorts of infections and diseases that someone with a strong immune system wouldn't pick up. So the medication is about fighting off the HIV virus by doing a number of things. Either it's by stopping, because there are many different types of medication. One stops the HIV cells actually attaching to white blood cells. Others stop the HIV cells multiplying. So there's a lot of medication that can help now.
Okay. And a person who is infected, let's hope it doesn't happen, but somebody who is newly infected with HIV today, is their projected lifespan similar or somewhat shorter than a HIV-free person?
It really does depend if they get medication quickly and if they stay on a good regime of medication. So as you were saying, for people on medication, it doesn't cure HIV, but it can keep it at bay. And there's a lot of evidence from international studies now that shows that if people get on treatment early and if they stay on treatment and look after their health, they can live almost as long a life as anybody else. It's not to say it won't be without some complications, but yes, life expectancy is now good. This is part of the breakthrough that medicine has brought.
Okay, so it's important to find out as soon as possible whether you are HIV positive or not in order to start the medication as soon as possible in order to maximise the risks, in order to minimise the risks and maximise your life expectancy.
I think that's right. What's really interesting is that when we see different types of people coming in for testing and different types of people are finding themselves HIV positive, it's often in very different circumstances. So, for example, heterosexual men often come to get tested very late, and there are a number of reasons for this. So, for example, a lot of men aren't looking after their health very well. They're not that interested in their own health. Heterosexual men aren't looking usually and thinking of sexually transmitted infections. When they go to their doctor isn't thinking, oh, maybe this is HIV. So it can be quite a long time before they're diagnosed. And as a result, they can get quite sick with HIV, and their health can suffer. Gay and bisexual men, by contrast, many more of them seem to be health conscious and also have some background awareness, at least, that HIV is an issue. And so we tend to see them coming earlier, so they get treatment earlier, and as a result, they tend to have less health problems. So we're trying to get everybody to come and get tested early if they think there's a problem, because you're right, as soon as people get treatment, they can start to get better.
Okay, if you have a question for Andrew, please call us, 8120-4479, or you can leave a question on the Lib Street bulletin board. You will need to log in first, leave a question for us, and then we will pick it up and pass the question to Andrew. A question about the medication, does the fact that medication exists and it can more or less give you the same life expectancy if you take it, does that make people act irresponsibly, do you think? Could that be one of the reasons why the infection statistics are increasing?
I don't think on the face of it that's right. I think there's a complex answer to this. I think the fact that there is medication doesn't make people think, oh, I'll take a risk. I haven't got condoms handy, therefore I'll take a risk because I'm not worried about HIV, because you can actually get medication. Anybody who you ask, would it bother you having HIV, would usually say, yes, I don't want HIV. And anybody who's been infected would say, I'd wish I didn't have HIV. But on the other hand, I would go back to the issue we were discussing before, that almost having medication has, I think for some people, has taken the urgency out of talking about HIV as an issue. And because there aren't people who are dying of AIDS, I think that's taken some of the urgency out of the public discussion that goes on. So I think that probably contributes to this lack of urgency that some people feel. I don't think it of itself means that people are taking risks.
Okay. Your strategy, AIDS concern strategy in Hong Kong, is called the 000 strategy for defeating HIV/AIDS. Could you explain what the 000 is, please?
Yes, of course. So we say that our ambition is for three things. We want to see 0 new HIV infections. We want to see 0 stigma for people living with HIV. And we also want to see 0 AIDS deaths. Some people would say, "Oh, that's too ambitious, isn't it? We're seeing 600 new infections every year. Can you really get it down to 0?" And I think probably my response would be, it is difficult. Of course, that's very ambitious, and it may be difficult to achieve in reality. However, we think our ambition has to be that one HIV infection is one too many, and we're going to do all we can to stop it happening.
Okay, you mentioned stigma. What do people feel? Do they feel that they will be ignored by their friends, or they will lose their friendship or the love of their families? How do HIV people, what kind of feelings do they go through in their day-to-day lives, and what do they suffer from?
When people get a diagnosis, it's often a stage of shock for them. People, they've been told you can live a long life and you can be on medication, but actually, people have found out they've got this difficult medical condition, which is stigmatized by a lot of people, and so people are shocked, and then they work through that, and often a lot of anger. So often they'll be talking to people at AIDS Concern about, how do I cope with this? What do I need to know? What can I do about it? And things like, should I talk to other people? So it's a big issue for people as to whether they should tell their family and their friends that they're HIV positive. And yes, people fear rejection, and most of all, people fear being treated differently, and they don't want that.
And do most people tell their friends and family? Do you have any statistics about that?
Most people will tell their partner, and quite a large proportion will, maybe half, I would say, would choose to tell their family, but a lot would choose not to. But of course, here in Hong Kong, it's a very crowded place. A lot of people are living with their families. It's very difficult to keep secrets if you have them. And, if you're having to take medication every day, or if you're having to go to doctor's appointments, then it can be difficult for people to choose to keep it a private matter. So lots of people struggle with this, and sometimes you can find ways to keep things private, and sometimes you can't.
What risks do people run by telling the world that they are HIV positive? Do they, for example, run the risk of losing their job?
Some people have lost their jobs. It really does depend on the person and the situation. I think fortunately, a lot of people are very good at working out the risks, and they make informed decisions about who do they tell and how. And I think often it helps to talk to other people with HIV who've gone through the same to work out what are the best ways to assess what's a risk, who should you tell, and how do you make it land properly. But yes, sometimes people do react very badly. I mean, I think one of the most common reactions that people tell us about is they say, I've talked to my family about it, and it's the big thing that we never again talk about. So whenever I say anything that relates to my health issue, my mother will say, "Oh, okay, that's fine, dear," and let's not talk about that too much.
Okay, like a don't ask, don't tell type strategy for families.
I think that's right. I think people don't want to talk about it because it's very stigmatised. It relates to a difficult medical condition. It's something that's related to sex. For some people, it's related to unfaithfulness and things like this as well.
Okay, but it is true in Hong Kong that HIV is covered under the Disability Discrimination Ordinance.
That's right.
So you cannot be discriminated against by law on the basis of your HIV status.
That's right. I mean, there has to. I mean, the ordinance says unless there's a very, very strong practical reason why it's reasonable to treat people differently, then actually you're not allowed to. But in fact, we know from the survey work we've done with people living with HIV that people do get treated differently.
And do they tend to follow that up in the courts?
Not usually, because usually people don't want to disclose their status publicly, or a way is found to resolve it. But, for example, we did some work with the Chinese University of Hong Kong where we surveyed nearly 300 people living with HIV and asked them, what sort of examples can you tell us about where you think you might have been treated differently? And a lot of people said they'd been treated differently. And so, for example, people would say, in a hospital, I was put last in line to be treated, and it was, in many cases, made clear to me this was because I had HIV. Or someone would say I was given plastic cutlery to use where everyone else was being given normal cutlery, and it was obviously because I'm HIV positive. So these are some of the real everyday examples that people tell us about.
But on a day-to-day basis, unless you are going to be coming into blood contact with somebody who's HIV positive, there is absolutely no risk of infection whatsoever. Is that correct?
That's right. I mean, probably the easiest way of describing it is to say that, yes, it's about contact with blood. And even then, it has to be that fluid is transmitted from one person to another. So just by giving someone a kiss on the cheek or shaking their hand, there's no way you're going to catch HIV. And
even by having a sports injury where you maybe cut your knee and you play in the team with somebody else, is that likely to cause infection?
Quite unlikely, but I think probably the public health message on this would be the same one as for lots of for cuts and grazes, to just be careful around people who've had an injury and be aware not to handle their blood and to wash it off if you have someone's blood on you. I mean, you're at risk of infection from a whole range of things. Very unlikely. I mean, unless, for example, you have a serious wound and blood goes from someone with HIV into your wound. Then it's very unlikely that you're going to catch HIV.
Oh, well, as a Westerner living in Hong Kong, I'm very conscious of the level of consciousness of people about spreading diseases and germs. That people generally do wear masks. They do have good habits when it comes to coughing and sneezing. So I think that would fall under the same category as cuts and grazes, right?
Well, we've been asked for advice on things like. Is it okay for someone with HIV to be working in a school or a hospital, and what sort of precautions should there be? And actually, there's a lot of medical guidance on this, because, for example, if someone is working in a healthcare environment, there is very little risk of passing HIV on with just some small standard precautions. And in fact, there are only about, worldwide in the last 30 years, there are only 3 examples of healthcare workers with HIV passing HIV on. So as long as, for example, the only difference in Hong Kong is where, for example, there are guidelines that the Advisory Council on AIDS sets out where if somebody is working in healthcare where they're likely to be involved in procedures where there is cutting, invasive procedures, where, surgery and things like this, then there are some additional requirements for reporting and making sure the right procedures are in place. But in most cases, there's no reason to be concerned about it.
So that's 3 people in the last 30 years in the whole of the world. So that's 0, practically. Okay. You have, in your prevention and education campaigns, I would imagine that AIDS concern comes up against a lot of prejudice and ignorance, and which makes their communication messages very difficult to get through to the audience. Can you give me some examples of that?
Yes, of course. I think the biggest problem is people don't want to talk about sex. So this is a really big barrier. And it's a barrier in terms of people saying, no, I don't want you to come and talk in my school, or I don't want you to come and talk in my workplace. And of course, people aren't always really open about it and saying it's because it's about sex. But actually, if you dig a bit deeper, that's usually the reason. And so what we need to do often is to make sure that we're talking to people about HIV in terms of relationships and health and people's rights, and thinking about the audience that we're talking to. And often it means for an organisation like AIDS Concern that we need to think about who are the people who can help us get the right messages to others. So if we can't easily get into a school to talk to young people, then, for example, we can help to educate teachers and social workers and parents, so that at least they can understand how do they incorporate information about HIV into what they're talking to children and young people about.
Okay, if you have any comments or would like to speak to Andrew, call us on 8120-4479 or Skype us on Radio Chinwag. I would be interested to see what you have been told in your school about HIV prevention. That would be very interesting if you could call in and let us know, or call in or write us a note on the Lib Street bulletin board. You talk about the changed message you got there. I watched your happy sharing video on your website a little while ago. I know that's part of our youth program, which we will be talking about next week. But it seemed to me that the focus was about love, relationships and communication rather than sex. That's obviously a deliberate part of your campaign. Right?
That's right. And I think that one of the reasons for that is because it is difficult to get people talking about sex, but it is also because I think it's the most powerful way to get people thinking about their health and their life. So, for example, one of the issues that we face is that a lot of young women in Hong Kong will say, if you ask them, so do you always make sure that you're having safe sex? They might say, oh, well, I leave that up to my boyfriend. He has to decide whether we have safe sex or not, and I leave it up to him to work out whether we use condoms and so on. And therefore, one of the messages that we talk to people about is think about your rights and your health, and we talk to people about how can you make sure that you are recognising your rights and your value, and you're requiring other people to look after your health and your rights as well. Because what we want is that whenever a young person or someone of any age is in a situation where they're about to have sex with someone, that actually they are in a position to say, we need to put on a condom now, and that if someone says, oh, I'm not sure about that, then actually they feel confident enough to say, then not this time. Right.
And that can be very difficult to do, I would imagine, yes. If a friend told you tomorrow that they had put themselves at risk in a situation similar to the one you've just described, how would you react and what would you say to them?
I think probably it's important to be human and be the friend. And I think one of the things that I guess we all try to do with friends is to keep people calm, and to offer what help is important. And I guess some friends like to have some advice. Other friends might want you to offer to go with them to take a test. So, as you were saying earlier in the discussion, some people are quite intimidated by the thought of going and getting a test for HIV. Very often we'll have friends accompanying friends who come to get tested. I was talking to a lady recently who had exactly the situation you described, and a guy was saying to her, "Look, I'm worried. I think I may have put myself at risk of HIV." And he didn't want to go for a test, but she said, "Look, let's both go for a test." And so they both went and got tested, and thankfully they were both okay. But I think a lot of people we find worry about these things for a long time before they go and get a test, and they've got this niggling concern in the back of their mind, and they think, "Oh, I might have put myself at risk," but they don't do anything about it. So one of our messages is, don't be haunted by your sexual past. Go and get help. Get a test so that you can be sure that you're okay, and then you can get on with living your life.
And if you're worried about going for the test, get a friend to go with you to help you. Okay, exactly. I have done that, actually. I had a friend who was really worried about putting himself at risk, and he refused to go for a test because he was terrified of going to the doctor.
Yeah.
So I kind of had to tie him to me and shackle him and take him to the clinic to get tested, and he's been back twice since then because he now knows what to do, where to go, how to make the appointment, and what's involved, and it's very easy. So if one of your friends, listeners, if any of your friends told them that they might have put themselves at risk or might even be HIV positive, you now know what you should do. If you want to go for a test, our listeners are going to be between the age of 14 and 18. We'll talk about this next week in more detail, but what should they do if they want to go for a test or feel that they've put themselves at risk?
Well, there are lots of options available for you, so really just tap HIV Test Hong Kong into Google and you'll find lots of different options. Either you can go to your doctor or another doctor, or actually you can call AIDS Concern or go onto our website and make an appointment to come to our testing service. I think it's quite interesting. Lots of organisations in Hong Kong, you'll see big, brassy, bold street signs saying, here we are. This is not the case in terms of AIDS Concern, because discretion is one of the really important features of our service. So we have a testing centre in a very discreet location in Yau Ma Tei, and there's no big signage, and people can go up in the lift and ring the bell, and a friendly member of staff will let them in and take them and give them a test. So I think this is really part of the service that helps people to feel more comfortable. So don't feel concerned, I would say.
And there won't be people standing outside the door when you leave saying, "Oh, you've just been for an HIV test."
No, I don't think anyone would come to AIDS Concern anymore to get tested if that was the case.
Okay, and what should somebody do if they just want to talk something through? If they're not sure, maybe they think they've put themselves at risk, they just want to talk to somebody, what should they do? They
can call AIDS Concern and ask to speak to someone. So we've got a team of people who faces these situations every day and can talk to you about, have you really put yourself at risk, and do you need to get tested? Or if you want to, you can also call the government hotline on HIV, which is on the web as well. But I would really encourage people to pick up the phone or come in and get tested.
Okay, and this service is obviously in Cantonese and English and other languages as well, or mainly Cantonese and English?
Well, mainly Cantonese and English, but yes, if people need extra help, we can get interpreters in.
Okay, great. All right. Any final comments you'd like to leave for our listeners?
I think probably the thing I'd like to say is be aware of things like HIV for yourself, but also for other people around you, so that you can be a good friend, a good partner, and a good family member. And I think it's not just about understanding HIV, it's also about understanding health and infectious diseases and how we can live happy lives. So be aware of your rights and your health, and in that way we can all have a happier, healthier Hong Kong.
Okay, thank you very much. A happier, healthier Hong Kong. There's a positive message to take away with this. Thank you very much.
Thank you.
Thank you for coming in, Andrew. Thank you for coming in. Grace.